I'm Dr. Dustin, and today we're going to be covering a number of conditions of the scalp that can lead to scarring, ingrown hairs, while we react to videos that I have found off of TikTok. I want to educate you a little bit on why it's important to see a dermatologist if you have these conditions and not just go to somebody and have the ingrown hairs pulled out, because there could be real problems that could lead to bigger problems down the road if not properly identified and treated. But we're of course going to have some fun while we do it, so let's dive into the videos. Alright, this person has a number of scars on the scalp. This could be caused by dissecting cellulitis of the scalp, hidradenitis, could be caused by acne, keloidalis, nuchae. There's a lot of different conditions that could lead to this many ingrown hairs, and this is going to get worse. I don't necessarily love plucking out the hairs because the follicles here are not healthy. And these hairs, when they start growing back, have an even higher risk of becoming ingrown, leading to more problems. Now these videos, I appreciate Gino, the barber, letting us use them. You guys can follow him on TikTok. But I do worry if these conditions aren't being properly diagnosed and treated. So we're seeing a lot of these ingrown hairs. They're kind of going after this one lesion that is more inflamed than some of the others. Almost looks like there could be a little pus under the skin there. Using good tools, using gloves, definitely I appreciate that. All right, this person probably has acne, keloidalis, nuchae. This is a scarring condition of the back of the scalp. It's more common in African American skin. And you get ingrown hairs that lead to a brisk inflammatory response that leads to scarring. So you get scar-type collagen formation under the skin, and these can be permanent. We inject them with steroids. These people are sometimes treated with anti-inflammatory medications. Antibiotics are sometimes necessary. And in very severe cases, you can undergo excision of these scars and actually let them heal by second intent. You don't stitch them up, because if you start stitching them, you're more likely to get more ingrown hairs in the area. So it's a very challenging condition. You can avoid this by not cutting the hair too short. So if you start getting these kind of bumps, let your hair grow a little bit more. Don't shave, especially with a razor. Plucking these out could lead to more ingrown hairs, because that hair's got to grow back through scar tissue. It's probably going to get ingrown again. These can definitely be painful as well. We're just seeing a small portion of the scalp, but kind of a big scar nodule there. And then just going after them one at a time. I just worry this is going to lead to more ingrown hairs and potentially a worsening of the condition, the acne, keloidalis, nuchae. They're just plucking away, plucking away. There's a big one there they're going after now. Big juicy one. Nice. I don't know if this is going to feel better for the patient after these hairs are out, but within 5 to 7 days, those hairs that start growing back could be more tender. Just something to be cautious about. You can see clearly that's the worst area, but as we go up, there's lots of smaller bumps, and these could get worse over time. Not a big fan of just plucking all these hairs out. All right, this person has a ton of inflammation on the scalp. When I see this on the body, it almost makes me think of a herpetic lesion outbreak. So like herpes of the skin. It just kind of has that shiny appearance, very red, very angry looking. I would definitely not be plucking out all of these hairs, because that hair trying to grow back through this kind of inflammation, this scar tissue, is really going to be at a high chance of becoming ingrown again. This also could be dissecting cellulitis. It could be discoid lupus, could even look similar to this, although I don't think it's discoid lupus. As we go through and pluck these out, I just don't think the outcome is going to be excellent here, but satisfying to see. Back on the scalp, this looks like acne keloidalis nuchae. The person is starting to get a lot of inflammation from ingrown hairs. There's a brisk inflammatory response from the immune system, and it causes scars to form on the back of the scalp. When I see patients that have this, I instruct them not to shave with a razor. Try not to even do buzz cuts because it increases the risk of ingrown hairs. Again, a lot of lesions on the back of the scalp for this patient. Very inflammatory. This is being done with a barber, and I appreciate Gino allowing us to use his videos, even if I might not agree with the technique of doing this, because I think the patient needs more significant treatment with a dermatologist to help take away the inflammation, limit the disease process so they don't keep getting ingrown and irritated hairs. When you pluck those out, the chances that it's going to grow back through that scar tissue, not great. They're going to get ingrown again. So if a hair is starting to come out through the surface, I'd leave it be. Allow this person to grow their hair longer so they're less likely to get the ingrown hairs. These lesions are big and juicy, probably a bit tender. And there's just thousands of hairs you could pluck out of here. So I don't know when they decide enough is enough. We are somewhere on the scalp, hard to tell. Probably the back of the neck, base of the skull.
You know, I'm going to be caffeinated till the day I die. I'm from Costa Rica. I love coffee. That will never change.
Just plucking those out. Acne keloidalis nuchae is the most likely diagnosis here.
Folliculitis, severe cases of folliculitis turning into what is called acne keloidalis nuchae.
Yes.
So what you
said it wrong, but got the diagnosis right. Does start out with a severe form of folliculitis. You lead to scar tissue formation.
Next, we are removing the ingrown hair shafts that are irritating the wall of the hair follicle. And if unattended for a while, resulting in permanent scarring and bacterial infection.
He's definitely got the pathophysiology right here. Permanent scarring is a feature of acne keloidalis. Infection is a large feature, which is why we use topical and sometimes oral antibiotics.
Clean, exfoliating with antibacterial solutions and a penicillin cream.
Penicillin cream, so I'm guessing he's probably not in the US if he's getting a penicillin cream, because it's not something that we use here.
Coming back. But as soon as this hair shaft is removed from the follicle, that bacteria drains pretty quickly, and he is going to start feeling relief from this inflammation.
So although the patient will feel relief after these extractions, the hairs will grow back because they're not destroying the hair follicle, and the ingrown hair will return, sometimes even worse, because every time you pluck out a hair, it increases the risk of scar forming in that hair follicle. Another case likely of acne keloidalis nuchae. This one is very juicy. We see a ton of lesions, and hopefully these patients, when they're getting extracted, they're also getting access to a dermatologist somewhere in their care to keep this problem from getting worse, because it is a progressive condition that leads to more and more scarring over time, more pain, and disfigurement of the person's scalp. The best thing that you can do is let these hairs grow and just adapt to a longer hairstyle, because you're much less likely to get significant ingrowns when you just let those hairs grow. Just keep them cut to a manageable length. This is kind of the condition I've always feared that I could develop because I shave my head. I do use a razor sometimes. A lot of times I use an electric trimmer. Today's electric. But I was worried that I'll start getting those bumps on the back of my scalp and then not be able to shave my head anymore. For the oral antibiotics, the most common one that we use is going to be doxycycline. It does help to kill bacteria that are common on the skin, but also it has a lot of anti-inflammatory properties to decrease all that redness that is happening. They're steaming it up. Patient is going to feel better for a while. Those hairs are going to grow back though. That's before, and that's after. So actually a really significant improvement. Hopefully this patient doesn't have them all come back. All right, this patient has a ton of inflammation on the skin. This is a very severe case. This is approaching the time where surgical intervention could be reasonable for the patient, where you would numb up that area and cut out this area of huge scar, and then typically we'll let that heal by secondary intention. So the body just closes the hole. We don't pull it together and stitch it, and that does lead to permanent hair loss in the area, but the skin is much healthier in general, and they're not going to be dealing with these ingrowns all the time. We'll see at the end of this video if we get a nice before and after and what this looks like, but there's infection here, there's tons of inflammation. See pustules down there on the bottom. I'm going to steam it up. No before and after, sorry guys. All right, this patient, on the face as it looked like, yep, a lot of scarring here, so probably previous acne. We could start to see a presentation like this in a condition called Discoid lupus, which is a form of lupus that affects the skin but leads to scarring. And again, plucking these out, the follicle is still there. It's going to produce hair again, so this is going to have to be a recurrent treatment that the patient goes through. They're doing this with their barber. I think if this patient presented to me, I would do a biopsy in this area to rule out discoid lupus, get their history on acne, and try to get a more comprehensive treatment plan than just extractions. We're dealing with the back of the scalp here. This is likely acne keloidalis nuchae as well. These hair follicles have a ton of inflammation around them. So when they're plucked out, they're going to get better temporarily, but the hairs, as they grow back, are likely to become ingrown again. This patient has a significant scar in this hair-bearing area. Whether this is the back of the scalp or the side of the face, I don't quite know. But this would likely be a surgical recommendation for me. If the patient came in, I would probably encourage them to cut this scar out. Depending on where it's at, we then at that point may stitch it up or may leave it open to close on its own so that they're not at risk of ingrown hairs in the future. This could be caused by acne keloidalis nuchae, hidradenitis, central, centrifugal, cicatricial alopecia. It could be caused by dissecting cellulitis of the scalp, hidradenitis. There's a number of conditions that could start to look like this, but this person's scalp is really not in good shape. Really not in good shape. Probably going to have some temporary relief by extracting these hairs, but the chances of them growing back normally are almost zero in this kind of skin. Rounding the video out today, we have no gloves, pimple popping. Cannot endorse this. We've got nails on some, artificial nails at least. Like what is going on here? They didn't open it up to begin with. They're getting that pus on their own fingers. It's probably their own hands, actually. Still would recommend gloves, but at least if you're doing it to yourself, I can understand it a bit more rather than doing it to somebody else. Guys, thank you for watching the video today. I'm Dr. Dustin. I'm a board-certified dermatologist, and when you watch my videos or subscribe to the channel, it helps support my mission of providing free dermatology care to underserved populations. Whether they don't have insurance, they're homeless, or whatever their circumstances might be, we take dermatology to them in my mobile clinic. I showcase some of that work on my other channel at Dr. Dustin Portela, and when you help to support by buying products through the links in the video description or just spending your time watching our videos, it helps to support that mission. So thank you for your time. I really value that. If you guys have skincare questions, drop them in the comments and I'll make some content to answer those for you. I'll see you on the next video.